Your blood vessels are lined with a single layer of cells called the endothelium, and the health of this endothelium is absolutely critical for aging. Endothelial dysfunction is one of the earliest detectable changes in cardiovascular disease, appearing years before clinical symptoms. It affects not just your heart but every organ system because every tissue depends on blood flow. The endothelium does far more than just form a passive barrier. It actively regulates vascular tone through nitric oxide production, controls inflammation, prevents platelet aggregation, and regulates permeability. When endothelial function declines, blood vessels become stiffer, blood pressure rises, atherosclerosis accelerates, and tissue perfusion decreases. This affects your brain, kidneys, muscles, everything. Nitric oxide is the key molecule here. The endothelium produces nitric oxide, which causes blood vessels to dilate, improving blood flow. Nitric oxide production declines significantly with age due to reduced enzyme activity, increased oxidative stress that degrades nitric oxide, and accumulation of an inhibitor called ADMA. Lower nitric oxide means higher blood pressure, reduced blood flow, and increased cardiovascular risk. Arterial stiffening occurs through multiple mechanisms as you age. Collagen and elastin in arterial walls become cross-linked and calcified. This stiffening means your arteries can't expand as effectively with each heartbeat, increasing systolic blood pressure and pulse pressure. Stiff arteries also increase the workload on your heart and reduce perfusion of organs. Dietary nitrates from beetroot and leafy greens like arugula and spinach can boost nitric oxide. Your body converts dietary nitrate to nitrite, then to nitric oxide through various pathways. Studies show beetroot juice consumption improves endothelial function measurably. The dose used in research is typically around 500 milliliters of beetroot juice or equivalent, providing about 400 milligrams of nitrate. L-arginine and L-citrulline are amino acids that support nitric oxide production through different pathways. Arginine is the direct substrate for nitric oxide synthase, the enzyme that produces nitric oxide. Citrulline converts to arginine and may actually be more effective than arginine supplementation because it bypasses first-pass metabolism. Dosing in studies typically uses 3 to 6 grams of citrulline daily. Cocoa flavonols are remarkably well studied for endothelial function. High flavanol cocoa consistently improves flow-mediated dilation, a measure of endothelial function. The dose that shows benefits is around 200 milligrams of flavonols daily, which is substantially more than you'd get from typical chocolate consumption. Specialized high-flavanol cocoa powders exist for this purpose. Berberine, a compound from various plants, shows multiple cardiovascular benefits including improved endothelial function, likely through AMPK activation and effects on lipid metabolism. Dosing is typically 500 milligrams 2 to 3 times daily with meals. Exercise is perhaps the most powerful intervention for endothelial health. When blood flows faster during exercise, it creates shear stress on endothelial cells, which signals them to produce more nitric oxide and improve function. Both aerobic and resistance exercise show benefits, but consistency matters more than intensity. Regular moderate exercise is superior to occasional intense exercise for endothelial health. Stress reduction has measurable effects on endothelial function. Acute stress causes endothelial dysfunction that can be measured within minutes. Chronic stress perpetuates endothelial dysfunction through multiple mechanisms including oxidative stress and inflammation. Mind-body practices that reduce stress improve endothelial function in studies. What damages your endothelium needs to be taken seriously. Smoking is perhaps the most potent endothelial toxin, causing immediate and cumulative damage. Trans fats directly impair endothelial function. Excessive sugar and refined carbohydrates drive oxidative stress and glycation that damage the endothelium. Even passive smoking and air pollution exposure harm endothelial function measurably. You can actually measure endothelial function if you want to track progress. Flow-mediated dilation uses ultrasound to measure how much your brachial artery dilates in response to increased blood flow. Pulse wave velocity measures arterial stiffness. These aren't routine tests but can be obtained through preventive cardiology practices if you want objective data. The practical protocol combines multiple interventions: dietary nitrate from greens or beetroot, citrulline supplementation, high flavanol cocoa, regular aerobic exercise with some resistance training, stress management practices, and strict avoidance of endothelial toxins like smoking and trans fats. Blood pressure monitoring provides an indirect marker of endothelial health. If you're doing these things consistently and your blood pressure improves, that's a good sign your endothelial function is likely improving too.